So now we're going to talk about tools for small group learning. Small group learning is based on a team-based approach that allows students to work together to achieve shared learning objectives. Small group learning activities are often based on 4 different principles. First, the activity is student-focused. Second, interaction between students and doing are the main goal. So it's important to keep them active and focused on your objectives. Next is working in groups is an important mode of learning. And they also need to work through structured approaches to real-world problems. So these are very important to keep these in mind as you're developing small group activities. It's important to know the advantages and disadvantages of working in small groups. Some of the advantages include that lecture can't hold the attention of a large group, so working in smaller groups gives the educator the opportunity to shift from passive to active learning. It also allows learners to bring their own experiences into the learning process. It encourages creativity, stimulates discussion, and can improve confidence and importance. It encourages and assists students in developing transferable skills such as teamwork, communication, collaboration, and leadership. And it allows students to learn from other students through their insights, opinions, and also their mistakes. Some of the disadvantages include that it requires a lower instructor-to-student ratio, which means depending on the size of your group and the number of groups you have, you may possibly need more instructors. It requires more instructor time outside of class to design activities. Management of group dynamics can sometimes become difficult. Facilitation can also be complex sometimes for the educator. So in managing some of the small group dynamics, it's important to ask open-ended questions so students will need to elaborate on their answers. The instructor should seek clarification or ask probing questions. So you have to really listen to what your students are saying as you ask a question. And then when there's an opportunity to probe a little deeper, or make them think a little deeper about some topic or subject, that you're ready to ask those questions. A moderate amount of time and frequency that students are responding. Moderate the amount of time and frequency that students are responding. So make sure that we all know that we have those students that like to talk all the time. We also have those students that don't like to talk at all. So it's important that everybody get a chance to answer and that you hear from everyone because this is also a form of assessment in hearing what your class members have to say. Promote students to work toward a common goal, the success of their learning. So it's all about the student, and we need to promote that common goal, that everything that we're doing is for their success in the course. 2 different types of small groups you can have are formal, which have a planned purpose and roles, or the more common are probably informal groups that can work over a much shorter duration without assigned goals. This is probably more common. So some small group learning models. There's a variety of different models in your in your book that are discussed for small group learning. We're going to discuss a few of them here. Team-based learning is a longer-term assignment where a group of students is assigned to a permanent team. Have a process to evaluate the work of each member and the team as a whole. So that's important because with many, one of the downsides to group work, especially the more formal types of groups, is that there always seems to be a student who thinks that they won't have to do anything because the rest of the group will do it, and it's a group grade. So it's important that you have a way to evaluate the work of each member as well as the team as a whole. Problem-based learning is a model where the instructor creates a complex, well-structured real-life problem that a group of students works together to solve. So as you're preparing for small group learning, it's important that your learning objectives or your lesson objectives should be clearly defined and attainable within the scope of the session activities. If you're doing group work for just that class session, it's important that they be able to complete the work in that class session. Give special emphasis to the concept of practice like we play. It's very important that we stop verbalizing as much as we have in the past. And if somebody's supposed to take a blood pressure, that they actually put a blood pressure cuff on, they have a stethoscope, and they actually take that blood pressure, then the facilitator can give them the information for that group process or that scenario. But if you're trying to get them used to, for example, how to do splinting and bandaging or something like that, it's important that they be wearing gloves so that they know what the gloves feel like, they get used to wearing them, and that any difficulties with doing a skill with gloves on are quickly overcome. We want to infuse a culture of safety into all of our learning activities. This is because every participant is responsible for the safety of the patient as well as the entire group. We need to really infuse this concept into EMS. So some common small group strategies. The textbook gives many examples for strategies for small groups. I'll discuss a few of them. Tutorials are listed. The tutorials are instructor-led discussion with significant student input. A seminar is typically led by students, and the instructor then facilitates that. An example of this would be if you are discussing myocardial infarctions, and where a student may provide a lecture or a mini lecture on how to have a healthy heart, which might include exercise, diet, etc. Case discussions are also a good way to have small groups interact. Students can bring a case with them that they have seen in a clinical experience or a field internship. The student presents the case, and the class can then dissect the case into specific sections to analyze. For example, how was the patient found? The clinical picture of the patient, any associated medical conditions of the patient, their pre-hospital care, and patient education that was done either by the EMS crew or the hospital staff. Role-playing is also a great small group activity. This involves 2 to 10 characters where students carry out a real-life drama or case and assume the various roles of the patient, provider, bystander, first responder, etc. The acting needs to be as realistic as possible. This is not an acting class, and we don't expect people to be great actors, but they need to act as realistic as possible in their role. Debriefing and discussion should follow. Debriefing and discussion should be a planned part of the activity. Role-playing includes very little medical equipment and focuses on the human interactions of the individuals involved. Peer review is another type of group strategy. This allows students to assume the role of evaluator and view the activity from a different perspective. Peer performance feedback can be helpful and important to the students. Comments need to be monitored by the instructor, however, to keep them as positive as possible. Simulation is also a great small group activity. This provides a great way to incorporate cognitive, psychomotor, and affective skills while working in groups. Can be used to open a class or close a class. Moulage always makes any kind of scenario or training more realistic, but it also takes more time. For more realism, you might think about moving to a different location. Instead of doing it in the classroom, move outside the classroom with weather permitting. Other options would be possibly a public park, making sure that you check with appropriate authorities to make sure that this is okay. You might try an apartment complex, hotel, or skilled nursing facility. Contact your local facilities in the area and see if they will allow you to use a hotel room for a class period. It is somewhat more of a residential style setup. You can have it act as or have it be a hotel room, or have it be a living room or whatever. Skilled nursing facilities are often very open to allowing you to use facilities that they may have, whether they be dining rooms, if they have open rooms at the time, or community rooms or community buildings or whatever. Use prompts, for example, medication bottles, beer cans, background noises, whatever kind of props you can get a hold of to make your scenario more realistic. Okay, so Think, Pair, Share is a very good type of activity to do, and we're going to watch a short video about this.
The Think, Pair, Share strategy is one of the classic active learning strategies that one can use in one's classes. And it has, as you might guess, 3 parts: the think, the pair, and the share. Often there's a collapsing of the pair and the share, but in general, you first give students time to think about a question or a situation or some other scenario that you want them to think about. And you give them time to think actively but alone about that. And often you can ask them to write down their thoughts. But then at the end of that short period of time, whether it's 3 minutes or 5 minutes, you have them pair up. And if it's a really big class or the numbers of students in your class warrant it, you can have them triple up. It doesn't have to be a pair. And they discuss whatever it is they came up with. It's just an opportunity for them to just say, here, this is what I thought of. What did you think about it? What did you think about what I said? So it's just an interactive opportunity for the students to hear from their peers. And then the key part when they're talking to each other is that the instructor should walk around the room and kind of eavesdrop on what the students are saying. So you want to understand the kinds of things they're talking about. Maybe not the specific details, but the kinds of things they're talking about. And pretty quickly you can learn if students are on the right track, or if there's a big misconception that maybe they might be reinforcing each other's misconceptions. So you want to know that as the instructor. So that's why, if possible, to walk around the room and just overhear what people are saying. That can be a really important part of that pair step. And then for the share, you have them report out. So this does 2 things. One, it lets you bring to light any specific comments that you overheard during the pair section. You can bring it up with the whole class, because there could be some really important, wonderful observations that the students make within the pair. And if you don't share that, or if you don't create a situation where that can be shared with the bigger class, then everybody misses out except for those 3 people. So it gives you an opportunity to do that. It also gives you an opportunity to globally clear up any misconceptions that you've heard that have bubbled up from this pair exercise. The other thing it does is, if there's a group of 2 or 3 or even 4, but I think 3 is probably optimal, the group reports as a group. It doesn't report as an individual. So if a student is a little insecure or may not really want to share what he or she thinks at a personal level or at an individual level, being able to share out as a group is a bit safer, is a bit more comfortable for many students. So that's what the share part does, and then it just gets the whole group together, and it lets you kind of sum up the smaller conversations with the larger group.
Teaching psychomotor skills provides a great opportunity for small group work. Skill sequencing is important. Make sure that new skills are introduced in a logical sequence that matches the cognitive learning material. It's important that the students have a pre-briefing, meaning that you prepare your students for what they'll be doing. Make sure that they have seen a proper demonstration of the skill or skills that they'll be performing before they're expected to do it on their own. Students must have seen the proper performance of the skill before practicing it in a group. Documentation is very important, and not so much, I'm not talking necessarily about run report type documentation, although you could inject that into your scenario as well and your skills. But I'm speaking more of documentation from the program's perspective for course records to document how many times someone has actually done a skill. For paramedic programs, we have the portfolio, which that is required, and I suspect that portfolios will become more and more popular at all levels of instruction. For skill assessments, you want to use valid assessment instruments, where you have these valid instruments. For example, use them such as National Registry, formative and summative psychomotor skill sheets. It's important that you determine student competency. Instead of having students, say, perform a skill 10 times, for example, the best practice is to use a success ratio instead of a finite number of attempts. So, for example, you might say 8 out of the last 10 attempts must be successful. Debriefing is also very important, should be planned into your activity. This is where the students critically reflect on their performance. Again, we're moving up that Bloom's ladder to higher level thinking skills and asking them to actually critique themselves and reflect on how they did. Lab sessions should be planned weeks in advance. The more detailed the lab session is, the more advanced planning you'll need. So you'll need to know what skills are you going to be doing? What sequence are they going to be done in? Is there supplies that you need to gather for this? Is there an inventory of props, an inventory of equipment? Are there consumables, such as medication bottles that they will be using to draw up medication in? What are the objectives for the lab session? Do you need lab instructors and directions for those lab instructors? There should be relevant skill assessment sheets, and if you're going to have an away from campus location, that will also take you extra time to plan that and to get the necessary permissions, and how do you transport people to another location, and those sorts of questions. So in summary, small group activities prepare students to work in groups, and this is a good thing. Understand the advantages and disadvantages of small group activities. Be prepared to manage those group dynamics. Many times, most of the time, they work well, but sometimes you get people who don't like to work in small groups, or somebody who wants to bully the rest of the group, and that sort of thing. So it's important that you keep an eye on those sorts of activities going on as well. Use a variety of strategies for small group learning. Group activities must be planned in advance so that all the working components are in place.